Welcome everyone. So this is going to be a short video on how to insert a pigtail chest drain. First of all, we would like to make sure that we've got the right side, the correct side of the chest for the chest drain insertion. So this can be confirmed by the team, including the doctor and the nurse. We will then communicate with the parents to inform them that we are inserting the chest drain. This may not be possible if it needs to be done under an emergency situation. If that is the case, it is important that we do tell the parents after the insertion. Next, we also need to consider the analgesia and sedation for this infant. That is whether they're on self-ventilating in air, on non-invasive respiratory support, or requiring invasive ventilation. So the diagnosis of a pneumothorax would be an infant with a respiratory distress and or an increase in oxygen requirement, reduced air entry on the affected side, asymmetrical chest movement, and a positive transillumination using the fibre optic light, or in some cases it may be seen on the chest X-ray. So now we're going to talk about preparing the trolley and equipment for the chest drain insertion. This needs to be done in a sterile manner. So for the sake of this, Tusha's using alcohol gel, but you would clean your hands with soap and water before. So we are going to first of all need a 1 ml syringe, and a 24 orange gauge needle. This would be for the local anaesthetic, so ensure that you have 1% lidocaine and you require 0.2 ml for the anaesthetic. Next, you'll need ChloroPrep to clean the skin. The chest drain kit, so ensure that is going to be a size 8 or size 8 French pigtail drain, that it's in date and it is completely sealed. So within this kit, please ensure that there is a pink needle, the guide wire, the dilator, and the pigtail drain itself. So next we will need a 10 ml syringe with a filter needle, and 0.9% saline, of which you will have to draw up 2 to 3 ml in the syringe. Next you'll need the green bung, three-way tap, steri strips, semi-occlusive dressings, scissors, gauze, and a sterile dressing. And a sterile drape, and then you'll need sterile gloves and your sterile gown. So the type of drains that you'll need, so initially whilst the baby's on the unit, you will have your underwater seal, which is demonstrated here by Tusha. So one will go to suction, and then the other white tubing will be connects to the baby once you've inserted the drain. Whilst the trolley is being prepared, the nurses can set up this drain for you. If the baby is going to be transferred, then you may require a Heimlich valve or a flutter valve. And on there it demonstrates which side is connected to the baby and which side connected to the drain. So now we're going to be focusing on positioning the infant ready for the procedure. So it's important to ensure that the temperature is maintained within normal range, and monitoring and heart rate and saturations on this baby can be done during the procedure, despite even during the sterile field. So this is the infant, and Tushar is now going to demonstrate how to find the landmark for the chest drain insertion. So he's going to find the first look at find the second intercostal space, and then go down to the fourth intercostal space, and then find the anterior axillary line. And this is going to be the insertion point for the chest drain. Make a little mark. Next is to remove any positioning aids to ensure that there's as much space on the relevant side of the baby for the chest drain insertion. And then we're going to tilt the baby right side up, given that this is a right-sided pneumothorax, and lift the baby's arm above the head and out of the way of the sterile area. Now, for the remainder of this video, we are now going to use a model to demonstrate the chest drain insertion. So this is the model. So the white plastic is representing the sternum, and then down the side we've got individual ribs and soft tape that demonstrates the skin, and another layer underneath for the pleura. Now that Tushar is gowned up with sterile gloves and a sterile gown, we're now going to clean the area for the baby. So using the ChloraPrep stick in a circular motion, we're going to clean. Then allow that to dry, and then we're going to place the drape above the insertion site. As you can see here, Tushar has cut a nice hole in the middle. So the sterile drape is now over the baby, and it's clearly demonstrated by Tushar. He's ensured that you can still see the baby's face to keep an eye on their breathing. Next, we're going to prepare the anaesthetic. So as mentioned earlier, it's 1% lidocaine, 0.2 mils, and at the insertion site, so fourth intercostal space, anterior axillary line, going to insert the needle and then draw back slightly to ensure that there is no blood, and slowly inject the lidocaine in a circular motion as seen, to ensure that the area at the point of injection site is adequately anaesthetized. When taking the needle out, you may notice a small amount of bleeding, and you can use the gauze to remove the blood. Then to wait a couple of minutes to ensure that the lidocaine takes effect. And now Tushar will have a needle and a 10 ml syringe. So the pink needle with 2 to 3 mils of saline in the syringe, and this will be inserted at the site. So it will be slowly inserted and advanced until you feel a pop, as demonstrated there. Then you draw back the syringe to see if you get any air. If any air is aspirated, then to document the amount of air aspirated. Now Tushar is going to mark where the needle is at the site of insertion with a steri strip. This is to ensure that for the remainder of the procedure, that the needle is not accidentally pushed in further. So Tushar is now going to remove the syringe and insert the guide wire. So as you can see here, it's curled. So Tusha is going to move the plastic to the end so that the guide wire is straightened, and then insert this into the pink hub of the needle. And slowly advance the guide wire until you get to the silver marking on the guide wire. He's then going to remove the plastic cover.
I have to let this go in.
Yeah.
So till the hub.
Yes.
Then
remove the plastic covering, and now he's going to remove the white hub while ensuring that he doesn't pull out the guide wire. Now he's going to use the dilator.
I need to take the needle out first.
Sorry. Going to remove the pink needle whilst holding onto the guide wire at the insertion site.
I might need some help.
Yeah, so at this point, if it's difficult to do with one person, you may want to consider this also at the beginning of the procedure for a second person to scrub in sterile. So as you can see, Tusha's slowly removing the pink needle, and then with the dilator slowly feeding it through the guide wire. As you can see, this may be tricky, and so you may need a second person at this point. So slowly feeding in the dilator and ensuring that you're not pushing the guide wire in further at the same time. When the dilator gets to the site of in-skin, then you twizzle it slowly. And again, you might notice a small amount of bleeding at this point, so you can use a gauze to remove the blood. And then now you remove the dilator, but again holding onto the guide wire to ensure that you don't push it in, as demonstrated here. Next, you are now going to put the pigtail and feed that through the guide wire. As you can see, it's curled, so you're going to have to straighten it. There are 3 small holes and then the black lines. So as you can see here, slowly fed through, holding onto the guide wire at the same time. So as with the dilator, you then slowly feed the guide wire through the hole that you have made.
The last hole went in.
Yeah, so that's the last hole there, and then as you can see now it's the black line. So you want to insert it just so the black line is at the site of insertion. Now whilst holding onto the chest drain, you're going to remove the guide wire. And now you are going to connect your syringe and draw back to make sure that you're still aspirating air. So now we're going to fix the chest drain. So you may see some variability here, but the important thing is to ensure that the chest drain is secured adequately so that it's not pulled out, especially with babies that may be active. So Tusha here is going to put 1 steri strip at the site of insertion. Another steri strip further down, and then he's going to do a loop with the chest drain, as seen here.
Is that okay?
Yep. And fix another steri-strip. So again, you may need a second person for the fixation, as it may be fiddly.
Like this? Should be a crisscross. Okay.
And then finally, you're going to use semi-occlusive dressings over the top, ensuring that the insertion site and the loop is completely covered. You may need more than one dressing at this point. So now we're also going to show you if we need to connect the Heimlich valve, so also the flutter valve. So as you can see here, to the right is where it's the lung, so that's the side you're going to connect to the pigtail drain, which Tusha is going to demonstrate now.
Do you want to pause it, please?
So we're also going to need the blue bung that would have been in the chest pigtail pack. So you connect the blue section to the flutter valve, and then the other section side would be connected to the pigtail drain. Now if the air is still draining, you'll now see fluttering of that valve inside. So thank you, Tusha, for demonstrating the insertion of a chest drain. You can also find the guideline on the Medway OFNU site, or please look at your local guideline for pneumothorax and chest drain insertion.